The next presentation is by Dr. Kishore Kumar, and the topic is ophthalmic implications following orbital trauma.
Good evening, everyone. I will be presenting on study on ophthalmic implications following orbital trauma. Coming to the introduction, road traffic accidents are the major public health problems causing high rates of morbidity and mortality. RTA is ranked 8th most common cause of death worldwide. RTA are responsible for a significant number of ocular injuries. Consequences following RTA may vary from a minor trauma to significant vision-threatening complications. CT scan of face, orbit, and skull with three-dimensional reconstructed imaging is quite helpful in diagnosis and decision-making. It has been reported that about 90% of ocular trauma are preventable with the appropriate use of protective safety glasses, helmet, and seat belts. The current study is a prospective cross-sectional study which was conducted at a tertiary care center to evaluate the epidemiology, clinico-radiological pattern of injury following orbital trauma. Total of 100 patients attending the casualty following the history of orbital trauma were included in the study. The study duration is of 6 months. Coming to the results, the most common age distribution is between 21 to 30 years. That is, out of 100 patients, 38 patients were in between 21 to 30 years, and most of them were males. That is 86 cases, while 14 were female. The most common mode of injury is due to had a history of road traffic accident, that is 68%, while 32% patients had other non-RTA causes due to assault, self-fall, sports injury, and agriculture-related trauma. And the most common injury subtype is lid laceration, followed by ecchymosis, subconjunctival hemorrhage, lid abrasion, and corneal perforation. Coming to the CT imaging reports, out of 100 patients, the 40 patients had orbital fracture. In that, the 24 patients had one wall fracture, 14 patients had two wall, and the rest another 2 patients had 3 wall fracture. And most common orbital wall injured was lateral wall, followed by medial wall, inferior wall, and superior wall. Discussion. Ocular trauma is one of the major cause of avoidable blindness. In this study, male is to female ratio was 6:1. That is, higher incidence of ocular trauma is noted in the males than the females. The study done by Moore et al. From Uttar Pradesh reported 88.40% males and 11.60 females were injury victims. Kumar Jay et al. From India reported incidence as 77.6% in males and 22.4% in females. This higher incidence of ocular trauma in an RTA in men can be explained by their more outdoor activities with increased traveling and rash driving. 56% patients treated with conservative medical management, while 44% patients required active intervention. The study done by Moore et al. Reported that commonest ocular injury was ecchymosis, followed by eyelid laceration, subconjunctival hemorrhage, and globe injury. Kumar Jay et al. Reported periorbital edema with ecchymosis, followed by eyelid laceration as a commonest type of injury. The commonest ocular injury reported by Mudaliar et al. Was subconjunctival hemorrhage, followed by ecchymosis. Orbit and periocular structures are the first structure to take impact of the injury in an accident. Coming to the conclusion, in conclusion, consequences of RTA may vary from simple abrasion to extremes of complete blindness in the affected eye. Males are predominantly affected than females. Multiple orbital fractures, intraocular hemorrhage, and posterior segment trauma, poor initial visual acuity are the sum of the manifestations of ocular trauma. Public health education regarding use of helmet and seat belt, early reporting, and appropriate intervention may reduce the vision-threatening complication and blindness in RTA-related ocular trauma. As road traffic accident causes lot of morbidity and mortality, safety measures has to be undertaken properly. The need of the hour is to abide by the traffic rules strictly, as prevention is always better than cure. These are my reference, and thank you.
Thank you.